Hello, thank you for joining me again. Today is Friday, April 24th. As promised, I wanted to deliver a quick update on WCHC and our response to the COVID-19 pandemic. I wanted to give you a quick update on some of our stats at Washington County Hospital and Clinic as of today. Through this morning, we have tested 537 patients at WCHC. We have 400 negative results of that group. We also have had 127 positives, and as of this morning, we have 10 pending. On that note, since March 18th, we have regularly been testing about 100 patients per week. We've seen with that an initial growth in infectivity rate. So when we first started testing, we were seeing about 20 to 24% of our patients were testing positive for COVID. That peaked in about early April, the week of April 4th in particular. About 33% of the individuals we were testing positive for COVID-19. I'm happy, I think, to report that so far this week we've tested about the same volume as we have in previous weeks, and we've got about a 12% positivity rate. We're not entirely sure what that means yet, but we have seen falling positivity rates for the last 2 weeks, and so I have some cautious optimism about what that could mean. At the state level, I wanted to let you know about a couple of things. The testiowa.com site is up and live and allows people to be evaluated for whether or not they qualify for a COVID-19 test. At the moment, individuals who qualify for that need to go to Des Moines to actually get tested, although they've indicated that testing would roll out to multiple sites across the state in the not distant future. In terms of us being able to do those tests here, we have an internal triage process that we use to identify individuals that are at risk, which is a little bit different than the Test Iowa site. We're evaluating that, but if you call our offices now, you'll be put through our standard triage process. So even if you've qualified at the state level for a COVID-19 test, we may not test you yet. We, however, might, just depending on your symptoms and other things. I also wanted to mention at the state level, the governor this morning indicated that as of Monday, she would allow elective procedures to commence again. She had several stipulations. If you'll recall, the reason the elective cases were discontinued in the first place was to ensure that we, as medical professionals, were able to have sufficient PPE or personal protective equipment for those individuals that were the sickest among us. Happily, and with the support of many local businesses and local individuals, we have been able to establish sufficient PPE, and at the moment we have supplies enough to carry us well into the summer. So we are going to be looking at how we can responsibly reopen our elective procedures over the next week or two. And so we're excited about that. We can do it safely. And there are a lot of people, frankly, who have been putting off needed medical care during this time. And so we are happy that we're going to be able to serve them again in the near future. One other note I wanted to let everybody know, we have been holding our Saturday clinics in our respiratory triage clinics and have dedicated those to respiratory illnesses. That volume has dropped to such where we are seeing 1, 2, or maybe 3 patients on Saturday. So we are going to discontinue that process starting this Saturday, tomorrow, and we are going to move our Saturday clinics back out to family medicine for treatment of normal kind of urgent care types of conditions, earache, eye infections, UTIs, rashes, skin conditions, minor sprains, those types of things. There's a list on our website if you have questions. We are, however, requiring it to be by appointment only. That allows us to evaluate if individuals are having respiratory symptoms, that we can get them treated appropriately and safely for not only themselves but for our staff and the other patients that are being seen. So we do ask that you call 653-7291 to schedule an appointment. I want you to know our primary care volume is increasing. So I do know that there's a lot of individuals that are putting off treatment for certain conditions. I do want to reiterate it again. It is safe to use our facilities. We take extensive precautions, both from a cleaning standpoint, an isolation standpoint, a PPE standpoint, and so I want to encourage you to use our services and understand that it is safe to do so. I also wanted to remind you to please send us any questions to covid@wchc.org, and we will be happy to get back to you either directly, as we've done this week, or I'll fold the answers into my Friday message. So thank you for listening, and have a great weekend.